Look at your fingernails right now. Press firmly on one nail for about 2 seconds, then let go. Watch how quickly the color returns. What you just did is a technique that cardiologists use to assess blood circulation in just a few seconds without any equipment. And what that simple test reveals, along with 3 other visible signs on your nails, can tell you something most adults over 60 never get to know. Your fingernails are silently recording your heart and blood vessel activity every single day. The problem is, almost no one is taught how to read them. And after the age of 60, when cardiovascular issues tend to develop quietly, without obvious symptoms, until a major event occurs, these signs on your nails become one of the few warning systems that do not require a hospital visit to read. In this video, we will look at 4 specific signs on your fingernails that medical research has linked to the risk of heart attacks, strokes, and serious circulatory problems. The 4th sign is what I want you to pay the closest attention to before this video ends. It is a sign you can check in just about 3 seconds, and most people are truly surprised by what they find. To fully understand why these 4 signs are so important after the age of 60, you need to understand a bit about the biology of your nails. Fingernails grow from a structure called the nail matrix. This is a layer of living cells located right beneath the base of each nail, and those cells are constantly in contact with your blood. They react to changes in oxygen levels, circulation quality, and the health of the tiniest blood vessels in your body. The capillaries under your fingernails are among the smallest blood vessels you have, and because they are so tiny, they are often the very first blood vessels to show signs of trouble when your cardiovascular system starts having issues. For someone in their 30s, the heart and blood vessels have a huge reserve capacity, and the body can hide early dysfunction for a long time without any obvious signs. But after age 60, that reserve capacity decreases. It is not because the body is broken, but because it has worked efficiently for 6 decades, and the margin for silent dysfunction becomes much thinner. Think of your nail bed as a window into the tiniest blood vessels in your body. When those vessels start having trouble, the nails are often the first place it shows. A doctor does not necessarily check your nails during a routine 15-minute checkup because time is limited. And checking nails, unless there is something visually alarming, is rarely a priority. So, this information exists in medical literature, but it does not always make its way from the clinical setting to the person who actually needs it. First is a color change called cyanosis. A medical review published in the StatPearls database indicates that the bluish-purple discoloration of the nails appears when the concentration of deoxygenated hemoglobin in the capillaries under the nail exceeds 5 grams per deciliter, or when arterial oxygen saturation drops below 80 to 85%. However, clinical studies clearly distinguish between 2 types with very different levels of urgency and danger. This changes how quickly you need to react to what you see. Cyanosis refers to a bluish or purplish tint visible through the nail bed, especially near the base of the nail. But there are actually 2 different types, and they mean very different things. The first type is called peripheral cyanosis. This is when the blue color only appears on your fingernails and possibly your toenails. Your lips, tongue, and the inside of your mouth remain normal and pink. According to physiological studies, this happens when the heart has a low cardiac output, or when peripheral blood vessels constrict, slowing blood flow to the limbs and causing peripheral tissues to extract more oxygen. Peripheral cyanosis develops gradually over weeks or months. It is your body's way of signaling that blood circulation to your limbs is not as good as it used to be. It is a warning, but not an acute emergency. The second type is central cyanosis. This is when the blue color appears not only on your nails, but also on your lips, tongue, and inside your mouth. Medical literature confirms that central cyanosis is an urgent medical emergency. This means that all the blood leaving the heart does not carry enough oxygen due to serious cardiovascular conditions such as severe congestive heart failure, heart valve disease, or respiratory failure. Research shows a strong link between persistent peripheral nail cyanosis and conditions including early-stage heart failure, certain heart valve issues undetected for decades, and chronic lung diseases that eventually put pressure on the heart. The reason this is so important for people over 60 is that the incidence of heart failure rises sharply with age, and it is one of the most commonly misdiagnosed conditions in older adults. Early-stage heart failure usually does not cause severe symptoms. There is no chest pain, no stroke, just a slow, silent decline in the heart's efficiency, with the body compensating for it until it simply cannot anymore. I want to share a patient story with you, a composite example of the kind of case I have heard described many times. It is the story of a retired postal worker named Frank from Sarasota, Florida. For nearly a year, Frank noticed his fingernails looked a bit purple near the base, especially in the morning and after sitting still for a while. He assumed it was just from the cold weather, poor circulation that he thought was normal for old age, and his tendency to feel cold easily. It was only when his daughter visited from out of state and commented on the color of his nails that he brought it up at his next routine checkup. His doctor did a thorough exam, ordered an echocardiogram, and found early-stage heart failure, which was still completely manageable with the right medication and lifestyle adjustments. Frank avoided a hospitalization that almost certainly would have happened within the following year. The takeaway here is simple. Check your fingernails under good natural light, ideally near a window. If the color near the base of your nails is bluish or purple, and that color does not change when your hands warm up, it is worth bringing up to your doctor. Specifically, ask if an echocardiogram is appropriate for your age and other risk factors. And if you see a bluish-purple color on your lips or tongue along with your nails, do not wait for an appointment. That is an emergency. Have you ever noticed any color changes in your nails? Type the word heart in the comments right now if you want me to make an in-depth video analyzing the warning signs of heart failure that you can recognize at home. I read every comment, and the topics with the most interest are the ones I will prioritize next. Second is brittle, slow-growing fingernails. And this is something most people over 60 just write off as a normal part of getting older. What I am describing are nails that break easily, peel in layers, crack vertically, or simply do not grow as fast as they used to. You used to need to trim your nails every 2 weeks. Now, they seem to barely change from month to month. According to studies published in the Lancet Global Health and Guidelines from the American Heart Association, the nail matrix requires a constant, rich supply of oxygen and nutrients to maintain cell division. When the arteries carrying blood to your limbs narrow due to plaque buildup, a medical condition known as peripheral artery disease, or PAD, chronic ischemia impairs nail matrix function, leading to brittle, easily broken nails and a noticeable drop in growth rate. Clinical research shows that PAD affects more than 200 million people worldwide and is a major indicator of systemic atherosclerosis. This is the exact same type of plaque that causes heart attacks when it occurs in the coronary arteries and strokes when it builds up in the arteries leading to the brain. The same type of plaque builds up in the arteries that lead to your fingertips or feet. Plaque in one artery means plaque is likely forming in other arteries as well. That is why peripheral artery disease is considered one of the strongest predictors of future heart attack and stroke risk. People diagnosed with PAD have a significantly higher risk of serious cardiovascular events compared to those without it. And what surprises most people is that PAD often remains completely silent for years before any symptoms show up. But there is a specific pattern of warning signs that tend to appear together, and recognizing the combination of symptoms is far more important than noticing any single one alone. The general pattern is this: brittle, slow-growing nails, cold hands and feet that take a long time to warm up, and cramping or a heavy feeling in your legs when walking, especially uphill or upstairs, which goes away when you stop and rest. This last symptom has a specific clinical name. It is called claudication, and it is one of the most reliable signs of severe arterial narrowing. If you experience all three of these symptoms together, brittle nails, cold extremities, and leg cramping when walking that goes away with rest, you should see your doctor for a consultation. A typical patient story that illustrates this is about a woman named Eleanor from Burlington, Vermont. Eleanor was a passionate gardener throughout her adult life. When her fingernails started becoming brittle and easy to break in her late 60s, she assumed it was just from years of working with her hands in the dirt and the dry Vermont winters. She tried supplements. She also tried drugstore nail conditioners, but nothing seemed to work. The change that caught her doctor's attention was actually something she mentioned in passing during a routine visit. She said her legs felt heavy when walking uphill, a condition that had been getting worse for about 18 months. Her doctor performed a simple test called an ankle brachial index, or ABI, which compares the blood pressure in your ankle to the blood pressure in your arm. The results confirmed she had moderate peripheral artery disease, with her ABI dropping below 0.90. Thanks to positive lifestyle changes, a structured walking plan, and the right medications, Eleanor significantly reduced her risk of cardiovascular disease. Brittle nails were the first sign she noticed, and they had been telling this story for almost 2 years before it was caught. The takeaway here is this: if your nails have become noticeably more brittle over the past 1 to 2 years, and you feel heaviness, cramping, or fatigue in your legs when walking, especially when going uphill or climbing stairs, ask your doctor about an ABI test. It is a simple, non-invasive test that can catch peripheral artery disease at a stage where making changes can make a massive difference. Now, the third method is the one I told you about at the beginning of this video. This is the one I want you to do with me right now. The third method is called the capillary refill time, or CRT test, and you can do it yourself in less than 5 seconds. Here is how. Hold your hand up at chest level. Pick any fingernail. Your index finger is a good choice. Press the thumb of your other hand firmly down on that nail for about 2 seconds. You will see the nail turn white as blood is pushed out of the tiny capillaries underneath. Now, let go and start counting. Watch how quickly that normal pink color returns. Studies on applied cardiovascular microcirculation in medical journals like Resuscitation and the American Journal of Medicine explain that the CRT test measures how fast the shallow network of tiny blood vessels refills after being squeezed. In a healthy adult with good circulation, the normal physiological CRT value for the nail color to return is under 2 seconds. If it takes 3 seconds or longer, especially when you try it repeatedly on multiple fingers in a warm room at 22 to 25 degrees Celsius, it is a sign that the smallest blood vessels in your body are not refilling properly. There is also a second test you can do along with this one that doctors find helpful. Gently press the back of your hand against your forehead or cheek. You should feel that your hand is close to the same temperature as your face. If your hands consistently feel noticeably colder than the rest of your body, even in a warm room, that is another sign of poor peripheral circulation. Doing both tests together gives you a much better picture than just doing one. Biologically, the capillary refill time test measures how quickly your microvascular system, the network of the tiniest blood vessels in your body, recovers after being squeezed. A consistently slow refill time means blood flow in those tiny vessels is sluggish, and studies have linked a capillary refill time of 3 seconds or more in adults over 60 to a drop in cardiac output, increased peripheral vascular resistance, undiagnosed atrial fibrillation, and a high risk of stroke. The microvascular system is often where cardiovascular issues show up first because small blood vessels have less reserve capacity than large arteries. An important note before you panic: if your refill time is borderline around 2 to 3 seconds, that is usually nothing to worry about, especially if your hands are cold or you are on certain medications. Some blood pressure medications and beta blockers can slow down capillary refill a bit without pointing to any health issues. Repeat the test in a warm room with warm hands. And if it consistently stays at 3 seconds or more across multiple fingers, that is when the results actually mean something. The reason this test is so important is that it gives you instant, useful feedback using nothing but your own hand. You don't need a doctor, you don't need equipment, you don't need an appointment. You just need about 5 seconds and good lighting. An example that shows the value of this test is the story of a retired postal worker named Walter from Topeka, Kansas. Walter saw a similar tip on a daytime health show and decided to test his capillary refill time on himself one evening. He counted almost 5 seconds before the color returned to his index finger. He tried it again on his thumb, his middle finger, and his other hand. The result was the same. The next morning, he called his doctor's office and described what he had observed. His doctor had him come in, did a full cardiac workup, and discovered that Walter had undiagnosed atrial fibrillation, a heart rhythm issue that is one of the leading causes of stroke in older adults. Walter was started on proper anticoagulant therapy which, according to current cardiovascular guidelines, likely prevented a major stroke within the following 12 months. The takeaway here is to do the test right now, before you finish watching this video. Try it on at least 3 different fingers. Make sure you are in a warm room with warm hands so that the cold doesn't mess with the results. If your refill time consistently takes 3 seconds or longer across multiple fingers, write it down and bring it up at your next checkup. Specifically, ask if a cardiac workup, including an EKG and possibly an echocardiogram, might be a good idea. Let me know in the comments right now how many seconds your refill took. I read every comment. And before we get to the 4th thing, which almost nobody knows about, if this video has been helpful so far, a quick like really makes a difference in helping the channel reach more people who need this information. The 4th thing is something I have saved specially for you, and here is why it deserves the final spot. The 4th thing is changes in your lunula. Most people listening right now have never heard the word lunula in their lives. Look at the base of your fingernails, right at the bottom, just above the cuticle. Do you see a small white crescent shape that looks almost like a half moon at the base of your nail? That is the lunula. It is the visible part of the nail matrix, the area where new nail tissue is actively forming in real time. And the lunula is one of the most overlooked diagnostic signs in the entire body. Here is something most people are never told about the lunula. The pattern of which fingers have visible lunulas is just as important as whether they are there at all. In healthy adults, your thumbs and index fingers almost always have distinct half-moons. The middle finger often has one too. The ring finger sometimes has it, and the pinky usually doesn't. That is completely normal. So, if your pinky finger doesn't have a visible half-moon but your other fingers do, there is no need to worry. What is concerning is when this pattern changes. It is when the half-moons you used to see on your thumb and index finger disappear, when the half-moons on all your fingers become practically invisible, or when their color changes from the normal off-white. In advanced medical literature, a ground glass opacity that covers about 80% of the nail bed, rubbing out the lunula, and leaving only a narrow pink or brown band at the tip, is a sign of a condition called Terry's nails, a clinical sign first described by Dr. Richard Terry in 1954. The landmark research by Holdsberg and Walker, published in the prestigious medical journal The Lancet, looked at over 500 patients and found this sign in 25.2% of cases. It has a particularly strong link to congestive heart failure, liver cirrhosis, and diabetes. Pathophysiologically, tissue biopsies show that Terry's nails are caused by a drop in capillary density near the base of the nail, combined with a buildup of connective tissue and wider blood vessels near the tip. Color changes in your lunula are especially easy to spot, and each change points in a different direction. Clinical studies show that a pale red lunula is linked to congestive heart failure and rheumatic diseases that affect the heart. A blue lunula can point to oxygen and circulation issues, similar to cyanosis. A very pale lunula that almost blends into the rest of the nail can indicate anemia, which has a significant link to cardiovascular strain. The reason this section deserves to be at the very end of today's video is that almost nobody is ever taught to check their half-moons. Yet, it is one of the body's most easily recognizable visual signs. Most people have never been told to look at the base of their fingernails for anything other than an infection. And because of that, a warning sign that should have sent them to the doctor gets completely ignored for years. One composite case that I found particularly rewarding involved an elderly lady named Dorothy in Asheville, North Carolina. Dorothy was 72 years old and had been generally healthy her entire life. During a phone call with her daughter, who is a nurse, she mentioned, almost as a joke, that the little white half-moons on her fingernails seemed to have disappeared. She could not even remember the last time they were there. Her daughter encouraged her to bring this up at her next physical exam, which Dorothy did reluctantly because she felt embarrassed to mention her nails. The doctor took her remark seriously, ordering a complete blood count and a cardiovascular risk assessment. The blood test results revealed severe, slow-progressing anemia. A cardiac exam also showed early signs of stress on her heart. Both conditions were managed before they could progress into any serious problems. The change in the half-moon area was the first observable sign, and it could easily have been missed for another 2 or 3 years if her daughter had not encouraged her to bring it up. In short, the takeaway is very simple. Take a look at your thumb and index finger right now under good natural light. If the half-moons on your nails have completely disappeared on most of your fingers, if they have shrunk significantly in recent years, or if they have changed color, that is something you need to bring up at your next checkup. Ask for a complete blood count and a cardiovascular risk assessment. Now that we have covered all 4 signs, let me give you a practical framework on what to do with this information. Because knowing something and acting on it are 2 entirely different things, and I want to bridge that gap for you. Let's start today with a simple step. Bring both of your hands over to a window with good natural light. Examine each nail. Pay attention to the color of your cuticles. Look for any faint blue or purple tint. Observe if your nails feel brittle or seem to be growing slowly. Perform a capillary refill test on at least 3 different fingers and record the time. Look at the base of each nail for the half-moon and note which fingers have a clear one and which do not. Take a photo of both of your hands. Having a visual record over time is incredibly helpful. Because gradual changes can be hard to remember accurately from week to week. If anything we have discussed today matches what you see on your own hands, write it down. Note the specific sign, which finger shows it, and how long you have noticed it. Bring that handwritten note with you to your next doctor's appointment. Print out or review these findings when talking to your doctor. Over the next 30 days, if you notice 2 or more of these signs appearing together, Do not wait for your annual physical. Call your doctor's office, describe what you have seen, and ask if a nurse can do a quick phone screening to help you determine if you need to be seen sooner. And most importantly, please do not self-diagnose based on any single symptom. What matters is the complete clinical picture, including your medical history, current medications, other symptoms, and your doctor's findings during an exam. The purpose of today's video is to help you engage in a more informed discussion, not to replace it. Here is my takeaway for you. Your body has been communicating with you your entire life. It has been sending you signals, some obvious, some subtle, every single day. And the wonderful thing about being over 60 is that you have more wisdom, more life experience, and better access to health care than at any other time in your life. Your 60s, 70s, and the decades beyond are not a time when making meaningful health changes becomes impossible. Ongoing research consistently shows that early detection and proper attention to these signs can dramatically improve outcomes, even in the later decades of life. The very nails you looked at this morning, and perhaps thought nothing of, might be the most accessible diagnostic window your body has provided. You just need to know how to read them, and now you do. If you found this video helpful, please consider subscribing to the channel. It really is the best way to make sure you do not miss our future content. And if a loved one, like a spouse, sibling, or friend, could benefit from knowing these 4 signs, please share this video with them. See you in the next video.